Hi Jenya, we're going to be doing your OSCE 1 today. I'm going to start by reading you a few instructions first. Okay? You have to get a 70% in order to pass the OSCE. You'll have 15 minutes to complete the OSCE. You'll be able to look at the headings form if you want. And if you finish early, you can look at the rubric and go back and do the things that you missed for half credit. Okay? Are you ready to get started?
Yes.
Alright, let's do it.
Hi, my name is Zhenya and I'm going to be your student nurse today. How are you?
Good, how are you?
I'm well, thank you. Can I get your name and date of birth?
My name is G. Gisma G. And it's April 1st.
Okay, thank you. And that matches the chart. And do you have any allergies?
Yes, ma'am, to penicillin.
And what is your reaction?
I usually just get hives all over my body.
Okay. So today I'm going to provide for your privacy. And we are going to be doing a head-to-toe assessment. It should not hurt, but you might feel some discomfort. I'm going to walk you with a step-by-step procedure, but if you have any questions in the meantime, you are free to ask me. Do you have any questions for me right now?
No.
Okay, are you ready to get started? Okay, so can I see your IV site? Thank you. The IV site is intact. It is not inflamed. The patient is having IV fluids of 500 milliliters of sodium chloride, which is infusing at 100 milliliters per hour. So now, can I, do you know where you're at right now?
Yes, I am at the Smart Lab.
Okay, and do you know what's today's date?
Today is April 10.
Okay, and do you know the time?
It's around maybe 4 p.m.
Okay, so patient is alert and oriented times 4. Can you please smile for me? Okay, the face is nice and symmetrical. And do you see how many fingers I'm holding?
4.
Okay, so the patient's hearing and vision is intact. Can you close one nose for me? Can you breathe in and out? Okay, and can you close the other one? Okay, can you breathe in and out? Okay, so the nasal passage is clear. On a scale 0 to 10, where 0 being no pain and 10 being the worst pain possible, do you have any pain right now?
No.
Okay, so now I'm going to assess your oral mucosa. So let me go ahead and put on some gloves. I'm going to Can I get you to go ahead and open your mouth for me? Okay, can you see? All right. Oral mucosa is pink, moist, and free of lesions. Can you move your tongue up for me? Good, and side to side. Good. So the tongue is also moist, pink, and free of lesions. Now we're going to listen to your lungs, okay? So I'm going to clean my stethoscope. All right, can I have you sit down for me? Thank you. I'm going to provide for your privacy as much as I can, but I'm going to be listening scope to skin, okay? Every time I put my stethoscope in a new area, I want you to take a deep breath in and out, okay? I won't be able to answer any questions for you right now, but as soon as we're done, I can answer the questions then, okay? All right. Relax for me. raise your gown up for me. Okay, now I need you to put your arm just across. Thank you. Deep breath in. And out. Okay. I'm going to come around. Take a deep breath in and out. On this side. Okay. Go ahead and lay down. So the lung sounds are clear anterior, posterior, and laterally, and no adventitious sounds are heard. Now we are going to listen to your heart, okay? So we're going to palpate for the sternal notch. We're going to go to the second intercostal space. This is aortic. Pulmonic, herbs. Okay, can I pull your gown up? Okay, if you can hold your breast for me. All right. I'm gonna do trachea and mitral. Okay, now we're going to listen for the murmurs. I'm going to switch to the bell. Mitral. Tricuspid. Go ahead and put your gown down. Herbs. Pulmonic, and aortic. Okay, so S1 is heard loudest at the apex, S2 is heard loudest at the base, the heart rate is regular, there is no S3 or S4 heard, and no murmurs are heard as well. So now we're going to proceed with our abdominal exam, okay? If I could have you go ahead and lay down, thank you. So first, if I could have you pull your shirt up. I'm going to pull that. I'm going to inspect your abdomen. Okay, the skin is normal to ethnicity. Okay, the contour is flat. There's no lesions is noted, and there's no pulsations is noted as well. So now I'm going to listen to your abdomen, okay? So now I'm going to listen to your abdomen. Right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Soft clicks and gurgles are heard. The sounds are normal. The bell sounds are normal. Now I am going to percuss the abdomen. Do you have any pain right now for me?
No, ma'am.
Okay. If I could have you flex your legs slightly. Thank you. Okay. Okay. Tympani is heard in all 4 quadrants. And now I'm going to slightly palpate it. Okay. Let me know if there is any discomfort. The abdomen was soft. There's no lesions or masses were noted, and the patient did not have any discomfort. Okay? If I could have you go ahead and sit down and put your legs down for me. Okay, now we are going to assess your musculoskeletal system. So now we're going to do upper. We're going to assess for the temperature. Okay, the temperature is warm to touch. The skin color is normal to ethnicity. There's no lesions or abnormalities is noted on the skin. So now we are going to do her radial pulses. The radial pulses are strong bilaterally. They're rated as 2 out of 3, which is normal. Now we are going to do her capillary refills. Okay, capillary refills are less than 2 times 10. So now we are going to do the ranges of motion. If you could repeat after me what I'm doing, can you flex for me? So that is flexion. Can you extend for me? That is extension. Okay, can you pronate? Thank you. And supinate. All right. Can you flex your elbows for me? So the range of motion is full. Now we're going to do the range of motion against the resistance. Can you go ahead and push against me? Thank you. And now can you pull? Thank you. So the muscle strength is 5 out of 5, which is normal against the resistance and against the gravity. So now we are going to proceed with the lower extremities. First, we are going to assess the skin for the temperature. Okay, skin is warm to touch. There is no lesions, abnormalities is noted. Now we are going to do her dorsal pedis pulses. Okay, the dorsal pedis pulses are strong bilaterally and they're rated 2 out of 3, which is normal. Now we are going to do a capillary refill on all 10 toes. Okay, capillary refill is less than 2 seconds on all 10 toes. Now we're going to assess for edema. Okay, no edema is noted. Now we're going to do range of motions. Can you go ahead and flex your knees all the way like this? Okay, thank you. And can you extend them all the way out? Thank you. Okay, and go ahead and, okay. Can you point down your toes? Good, and point up, okay. So range of motion of the lower extremities is full. Now we're gonna do it against resistance. Can you push against my hands? Thank you. Can you pull? Thank you. So the muscle strength is 5 out of 5, which is normal against the resistance and gravity, and she's strong. So now that completes our head to toe assessment. We're going to put you back into bed and the doctor will be with you in just a moment, okay? If you could have, go ahead and lay it back in bed. Okay, I'm going to lower the bed into the lowest position and lock it. Okay, the 2 side rails are up. Would you like the third?
No, thank you.
Okay, and the call bell is right at your side. Okay, do you have any pain right now?
No.
Okay, and the doctor will be with you in just a moment, okay?
Thank you.
Okay, Jenny, you did a very good job. You got all of the points, so you got 100.
That's
Good job.
Thank you.
Mm-hmm.